There's a new health concern tied to the pandemic. The risk for diabetes for children who develop COVID has increased significantly. Joining me on the morning show, Dr. Larry Fox, head of endocrinology at Nemours and an expert on diabetes. Good morning.
Good morning.
So I think it's important to note that we don't want to be alarmist here. This study from the CDC shows there is basically an association between COVID and diabetes, but there's nothing to indicate a cause at this point. Does it need more study?
Absolutely. And I think that's a very important point to emphasize, that correlation doesn't necessarily mean causality. Definitely there are more data that are needed to further evaluate this.
So what's the biggest takeaway at this point from that data?
Well, I think the biggest takeaway is that parents have to be proactive in preventing the disease. And that means vaccinations for those that can get it, those that are in the age constrictions. We need to be able to vaccinate anybody who's eligible, and those that are over 12 can also get the booster. And then they need to watch for the signs of diabetes, like increased thirst or urinating more frequently, or accidents at night, or weight loss that's unexplained, or breathing problems. Those need to be watched for, the signs of diabetes. But the best thing is to prevent the COVID to begin with vaccinations.
But it is a fact that diabetes can be exacerbated by other conditions, and it's something we need to be mindful of. So what do parents need to do to be proactive?
Again, they need to be vaccinating. They need to be able to watch for the signs of diabetes, and that will help the children who are developing it prevent the COVID to begin with.
Isn't there some new data that's supposed to be coming from Europe that may give us a clearer picture of things about, perhaps some sort of a tie?
There are some other studies that are occurring in adults as well as children, but those data are not available yet.
Now, we heard some basically broad numbers from the CDC about nationwide. You sent me some numbers about here in Northeast Florida and the growth of diabetes since the beginning of the pandemic. And it seemed that the numbers here in Northeast Florida were higher than what we saw nationwide. What does that tell you?
Well, it could be multifactorial. The actual numbers we are seeing here in Northeast Florida, and that includes Southeast Georgia, have definitely been increasing over the last several years, even before the pandemic. But they've risen dramatically for both type 1 and type 2 diabetes over the last couple years since the pandemic started.
So you talked about some of the signs that, diabetes, there may be an onset of diabetes, increased thirst, increased hunger, unexplained weight loss, increased urination at night. The fact of the matter is that there are some lifestyle issues that parents have to address as well with our kids that can prevent the onset of diabetes.
Well, that's true for those that have type 2 diabetes. There's a lifestyle component, increased sedentary lifestyle, and that did start during the pandemic. So some of the increase we see may have to do with some lifestyle and societal changes because of the pandemic.
Dr. Larry Fox, appreciate your expertise and appreciate you joining us on this Monday morning.
Thank you. You're welcome. Thank you.